question over here in the audience.
Yes, my name is Martha Cameron. I'm a DARE cab member. I'm also a woman living with HIV. Very grateful and excited to be talking to you. I have two questions real quick. One of them that I've never ever been able to get a good answer about, and that's, as you talk about discovering the retrovirus and the virus and how it was affecting both men and women. In the early days, they would do clinical trials and they would say women would be excluded because technically because we bear children. But I really wanted to know if what that is, what the difference, why, if there's a difference in the way the virus works in men and women, and if it has something specifically to do with the fact that we have estrogen and all of that. I'd really love to get a clear answer. And then the second one is, just came back from Vancouver, and they were talking in the conference over there, they were saying that people living with HIV are actually living very healthy and productive lives. In some cases, I think they went as far as saying even better than regular people. And in which case I thought they were saying our immune systems are functioning almost as normal as regular people. And you're saying not really, because you would like to get...
No, sorry, I didn't mean to say that. I would say for some people for sure no. But for a lot of people, especially people who get on drugs early on and do well with them, absolutely.
But your first question, the virus doesn't know whether it's in a female or a male. And I don't know of evidence, but there could easily be, and I wouldn't know it, that hormonal status has anything to do with the growth of the virus. I think women were excluded from trials early on because the drugs are very powerful mutagens in principle, and they wanted to keep the drugs away from a fetus, and so they didn't want to run the risk of women being pregnant in the trials. That was very early, and I don't know what the situation is now. I'm not a physician, and I never treated anybody in my life for anything, which you should all be glad of. So that's about as far as I can go. You may be able to go further.
I would say you're exactly right. I think it's very appropriate when things are new and we really don't know what the risks are to exclude all sorts of groups of people from clinical trials, including women of childbearing age. But then you get to a point where you understand that this should not be a reason to exclude people. And I think we get a little bit lazy. Honestly, it's easier to just sort of enroll men in a certain age group and not deal with all the complications around enrolling women. No. But I think for sure people understand that this is not appropriate anymore, and more women are being included in clinical trials, and people are really making that a point. So I think it's not malicious. It was done initially for very good reasons. Those reasons are not so good anymore, and more women are being enrolled in clinical trials. And to your point about hormones, I mean, there's some really exciting and interesting data coming through right now. There was data presented by, I think, Jonathan Kahn about the role of estrogen in setting the levels of the reservoir. So, I have noticed men and women are different, and it would not surprise me if our reservoirs and our sorry, it's out of the corner of my eye. I see people laughing. And it may be that, when we get to the stage of having therapies, just as medicine is moving more towards tailoring things and thinking about things, not just how we treat a population, but how we treat individual people, for sure we're going to have different approaches, I think, in men and women. Subtly different, maybe, but different.
So aside from the fact of protecting the fetus, it sounds like in clinical trials, historically, there has been discrimination with regard to women being included, or is that too strong of a statement?
I'm not going to call it discrimination.
Because they could have been involved, but they weren't for what reason?
Again, I think early on, for very good reasons, safety.
Right, okay, the fetus, sure, absolutely.
And then maybe it becomes convenience to some extent, but people and physicians are very aware of this now, and certainly people who are funded by agencies like the National Institute of Health, you have to think long and hard about who you're including in your clinical trials, and there's really an appropriate level of thought about whether to include women. And really the default should be you always include women. You kind of have to justify why you wouldn't include women. And I would also say, we haven't talked about it tonight, but there's also consideration about including children in clinical trials as well. That's a group of HIV-infected individuals who can have a disease with quite different characteristics, and they are often excluded as well. And sometimes it's for very good reasons of safety. Other times it's because, God, it just gets even more complicated when we think about children. Not a good reason to.
And trans populations?
Absolutely. Yeah.
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 We have a question.